Sorry about that. Good morning, everybody, and thank you, Teddy, for that really lovely warm welcome and that warming up the crowd. We really appreciated it. I met Teddy on Friday at the wonderful ACON and heard about the amazing team that he leads. So I just want to give that team who do great work for the community a really big shout out here this morning. Give them a big clap. They're amazing. Can I too begin by acknowledging the traditional custodians of the land, the Gadigal people of the Eora Nation, pay my respects to their elders past and present, and to First Nations people here today. I'd like particularly to acknowledge the leadership role of First Nations people in World Pride, especially here at the Human Rights Conference. I am proud to be part of a government committed to the Uluru Statement from the Heart in full, that is voice, treaty and truth. I'd like to acknowledge also that I've been reminded over the last couple of days that First Nations communities may well need a great deal of support as we debate the voice. There may well be hurtful things said, there may well be triggers, there may well be a need for us to embrace First Nations brothers and sisters and put our arms around them, as we did during the plebiscite. So I'm just reminding us of that. I'd also like to acknowledge our esteemed panellists, Dr. Talaling Mofokeng, I believe commonly known or much lovingly known as Dr. T, Dr. Ruth McNair, AM, Associate Professor Adam Bourne and Dr. Clara Tuck Meng Su. I want to thank them in advance for their sharing their knowledge and experience and wisdom. It's going to be a really wonderful panel. Well, happy World Pride. It is a great pleasure to be with you all here today. The city is abuzz. It's great to walk through Sydney. I was lucky enough to be at the opening concert on Friday night, which was really great fun. But what I found particularly special about that concert, and this is true of Mardi Gras and of Midsummer in Victoria, is that it did an amazing job of striking the balance between a celebration of LGBTIQA+ communities while staying true to the spirit of activism which has underpinned Pride for so long. The wonderful Robin Kennedy, who represented the 78ers on stage on Friday, put it beautifully. She said, "We are unstoppable because our task is not simply a cause, it is our very existence, our right to live freely and openly. And while tonight we celebrate, we never forget those prevented from doing so. We gather here for them, because no matter the barriers we face in the community, we never turn back. We never give up. We always rise." And I know that's the spirit in which you've all gathered here at World Pride Human Rights Conference. And for Australia, in hosting World Pride and this conference, we're presented with an important opportunity to, yes, acknowledge how far we've come, but also to acknowledge the failures of the past, to identify what needs our attention and determine how we can get where we need to go. There's still so much work to be done, especially in improving health outcomes for LGBTIQA+ people. We already know they have poorer physical and mental health outcomes, unique and often complex health needs, and difficulty finding and accessing appropriate health care. And this is especially so for young people. And despite all we have achieved, there's still discrimination and bias in this country, both casual and overt. This is, of course, inextricably linked to adverse health outcomes. I know, and we as a government know, these issues are complicated and there's much to do. But first, we must fully understand the needs and the wants of the varying and diverse communities and individuals captured under the LGBTIQA+ umbrella. The new pathway to better health must be paved together, and that's taking Australia's first ever national health consultation with LGBTIQA+ people. Now, that consultation began in earnest yesterday, and I have to say in earnest. I hosted the first roundtable to discuss the health and wellbeing of the community. We heard first-hand experiences and challenges faced by the community. I was joined by the Minister for Mental Health, Suicide Prevention and Rural and Regional Health, Minister Emma McBride, and by Senator Louise Pratt, who is a well-known and much-loved supporter and advocate of the community. We heard about the difficulties that people are getting accessing healthcare and the support they need and deserve. A few key points resonated with me from yesterday. And this isn't exclusive, this is a few things that really came to me. The importance of intersectionality, to have an intersectional lens over everything we do. The importance of data and research to inform the processes. The need to really care and embrace our young ones. The importance of public affirmation and feeling safe. And when it comes to health services, they must be community-controlled and peer-led. And it highlighted that we must commit to action, which is why I am really proud to announce here today that the Albanese Labor government will deliver a 10-year national action plan for the health and well-being of LGBTIQA people. The sector called for it, and we've heard you. The action plan will be informed by the national consultation I mentioned before. The lived experiences of LGBTIQA people and the organisations that serve them will form that plan with us. We will keep listening. The community's voices will be front and centre as the plan is developed. So we're going to establish an advisory group to inform and guide us to ensure that the action plan really does reflect the needs of the community, whoever they are, wherever they live. And I can assure you that while that's happening, developing the plan, we're not going to rest on our laurels while we await for it to be done. Sensible, critical work must and will continue to improve the lives of LGBTIQA+ people. We know that the health system does not work well for gender and sexuality diverse people and people with innate variations of sex characteristics. Research is critical. It's critical for better understanding of their health needs and improving how the health system can provide effective and safe care. So it's with this in mind that I can also announce, I'm very excited about this, that our government will invest $26 million in research grants to find new and improved ways to provide healthcare to your communities. This represents the largest ever investment into LGBTIQA+ research by any government in Australia. We'll target various communities, intersectionality and geographic disadvantage. The grants will focus on co-design between consumers and researchers, and again this will put you and those who work with you at the heart of the progress. So in closing, I'd like to say thank you. Since becoming the Assistant Minister of Health and Aged Care, I've had the privilege to meet many of the organisations, the workers and the activists on the front lines, delivering for your communities every day. All too often, I know this is done without funding, and for far too long, it's been done without the support of government. I really want to be clear today to say, I see you, I hear you, I want to stand with you. The commitments I've made this afternoon are for you, but they're only being made because of your hard work, because of your activism, because of your advocacy, your persistence, your consistent messages to us. I can't wait to continue working with you to deliver them. Thank you so much for having me, and I really look forward to hearing the panel. Thanks, everyone. Thank you.